Hello, everyone. Thanks very much for joining us today for this short webinar with Dr. Okker, who's going to be answering your questions about the live blood analysis training course and also any questions about microscope systems as well. So thank you very much for the questions that you sent in, which I'll be posing to Dr. Okker. If you do have any other questions, please put them in or write them in the chat box, which you'll see at the bottom of your screen. So that way we'll get them answered for you. So let's get started. I'm going to hand you over to Dr. Okker now. Are you ready for some questions?
Yes, absolutely. Thank you, Elizabeth, and welcome everyone.
Okay, so the first question is, what specific issues can be detected in live blood analysis?
All right, that's a great question. Perhaps the first thing to point out or to mention is that live blood analysis is not a diagnostic technique, so we're not using live blood analysis to diagnose medical conditions based on what we see in a blood sample. The value of live blood analysis is not specifically to diagnose medical conditions, but rather to uncover and identify imbalances in the system that often actually precede a diagnosis of a medical condition. So as we know in the field of natural medicine, there's a long history of processes and things and imbalances that take place for over a long period of time before any diagnosis or any actual disease actually gets or sets in. And live blood analysis allows us to identify all the underlying imbalances that actually allow for those diseases to develop. So extremely valuable in the field of preventative healthcare, where we can identify things many years before a diagnosis is made, and where corrective steps can then still be put into place before the diagnosis, when we can still easily reverse the process through some simple naturopathic and nutritional interventions. So live blood analysis can help to identify those imbalances, and that also allows the practitioner then to track and monitor those imbalances. So in the field of conventional medicine, most doctors have access to conventional blood tests and laboratory investigations. For someone working in the field of natural medicine, those tests and investigations are really of limited value. We're really not able to tell much about the intricacies of health and disease from conventional blood tests. It's more applicable to disease care once someone has a diagnosis, how to identify and then manage that condition. But when it comes to preventative healthcare, those tests are really of very little value. So the imbalances that we identify with live blood analysis really are the fundamental imbalances in the system that help to maintain optimal health. And if those imbalances are addressed, we're able to get the system into a place where the body is able to actually heal itself. This is often what's referred to as obstacles to cure in complementary medicine. Despite someone taking the appropriate combination of supplements and following the appropriate recommendations, they're still not really seeing results. And in those cases, there are obstacles to cure that are really preventing the system from responding in the way that it should. In live blood analysis, it really gives us a very quick glimpse into what's going on at the cellular level. So we're able to identify those imbalances and work with them. These are the very parameters that anyone working in the field of natural medicine need to be able to identify and monitor. These are the things that we actually work with on a daily basis with our clients. So we look at things like the balance between nutrition versus toxicity, levels of oxygenation, levels of oxidative stress, various balances of microbes in the system, so we can see signs of infection, we can see signs of dysbiosis, things like candida, very easily identified with live blood analysis. The test is combined with dry blood analysis, which also shows a host of imbalances that we work with that are often not identified in live blood analysis. And these include things like heavy metal toxicity, degenerative patterns, stress on specific organ systems, deficiencies, as well as excesses in terms of the inappropriate choices in terms of diet and lifestyle. Many of these factors are really what we often refer to as self-inflicted, because they really are brought on by the incorrect choices in terms of diet and lifestyle. So people following dietary patterns and a lifestyle that's not really conducive to optimal health. And live blood analysis helps to identify where those issues are and helps us to correct them and, of course, monitor them during the course of treatment. So there is a long list of anomalies and imbalances that can be identified. I can provide a few that we usually look for. As I mentioned, toxicity. pH is very, very important. We can see whether the system is functioning in its optimal pH, various vitamin and mineral deficiencies, digestive imbalances and issues with digestion. There's a very foundational understanding in complementary medicine that a lot of our state of health is determined by the health of the digestive system. So a lot of it comes down to what's going on in the gut. And in live blood analysis, we can really filter down and work out exactly where the issues are in the digestive system. Also other hormonal imbalances, things like adrenal stress, very common, seeing signs of adrenal burnout in the blood. And also very interestingly, also the white blood cells, we're able to see various indicators for the immune system because it's actual live blood that we're looking at. We're able to actually see these cells still behaving like they would inside the body, as opposed to a conventional blood test where the sample is stained and preserved, and they're looking at essentially a dead sample. In live blood analysis, we look at live living cells, and we're able to actually see the activity of these cells. So in many cases, we see signs of an underactive immune system, even in cases where the blood tests may have shown that the indices, the normal levels of the white blood cells are in normal range. There's still an issue with the immune function, because when we look at the actual white blood cells under the microscope, we can see that there isn't really any movement. So the viability of the white blood cells are affected. So very valuable as a tool for anyone working in the field of natural medicine, anyone involved with parameters involving things like nutrition, oxidative stress, toxicity, inflammation, all of these factors that are often related to lifestyle that we understand now are the most fundamental causes for most chronic diseases.
So are you saying that with conventional tests, the results are usually, the conventional tests are when it's too late to help the client?
Yes, absolutely. In many cases, it is already at a very advanced or very late stage. For example, if you're diagnosed with having high blood sugar, it's already late to start working on preventative measures to help manage your blood sugar levels. There's been a long history of things affecting the blood sugar levels and the levels being out of balance, underlying issues that we would have been able to identify with live blood analysis, that we're able to then manage at an earlier stage. Whereas, if you have the high blood sugar test result, the protocols tend to be a lot more difficult, and improvement takes a lot longer because there are actual organic changes already at that point in the system. So yes, live blood analysis is extremely valuable in prevention because we're able to detect imbalances that you're really not able to detect through conventional testing.
Okay, thank you. And can live blood analysis help gauge results of treatments?
Yes, absolutely. That's one of the benefits of live blood analysis, that it allows us to visually monitor what's going on with the client's state of health. So we're able to see what's actually going on in the system by first scanning through the sample, and since it is a visual type of analysis, we're basically looking for anything that shows up during the test. as opposed to a conventional test where things have to be ticked off on the form for the, for the lab to actually perform those tests. And again, in those cases, if the practitioner didn't think of testing for something specific, there's a chance that something would be missed there. With live blood analysis is a visual type of test, so we look through the whole sample at what's showing up in the sample, and we're very easily able to identify what the main issues are that need to be worked with in a case.
Okay, thank you. So how often do you recommend to have the live blood analysis done?
Generally, we follow up at about 4-week intervals. 1 month seems to be the best time frame, for clients to follow some interventions, to follow the protocols, and for changes to take place, and for us to then see and assess those changes in the follow-up.
Thank you. And do you have several detox protocols?
Yes, so we do have a detox protocol included in the course materials. And this is more of a conservative type of detox protocol that can be used and would be applicable to most clients that you see in a day-to-day practice. It's not incredibly intensive in that it would cause major detox symptoms or be too difficult for elderly clients to deal with. So this is a detox protocol that can be used on, in most cases for most clients. It's a 2-week type of protocol, and we usually see remarkable results. After the 2-week detox, if we test the blood again, the changes are usually quite incredible and very encouraging for people to see then. Especially if there was a lot of room for improvement in the sample initially, the changes can be really quite drastic after a simple 2-week detox.
Thank you. And what prerequisites are requested to be a live blood analysis practitioner?
Okay, well, since it's not a medical test, it's not used for medical diagnosis, there's no real requirement for live blood practitioners to be medical practitioners. There's no need for a medical background. It is a test that's used mainly within the field of natural medicine. Any practitioner involved in any type of modality in natural medicine or nutrition will be able to utilize live blood analysis and will benefit from it. There are some medical practitioners, especially those trained in functional medicine, who also make use of live blood analysis. And, in those cases, you're also able it is able to assist with making a diagnosis. So practitioners find that it helps a great deal in narrowing down the potential diagnoses in a specific case, because they're seeing, very specific indicators in the blood pointing to, for example, the liver, instead of having to then test for various conditions. They can simply test for what is the most likely issue, as based on what they saw in the blood.
Thank you. Could Dr. Okker speak about the process of setting up the microscope you are selling and how easy it is, and would it be suitable for easy breakdown and set up in different clinics?
All right. Yes, no, absolutely. We supply these microscopes to our attendees from all over the world. So the microscopes are sent from our offices via courier, and there is some minor assembly required to set up the microscope, but it is quite simple, and we do provide very detailed step-by-step instructions. There's printed instructions that's sent with the microscope, and also a link to a video showing high quality videos showing exactly what needs to be done to set up the microscope. We also have live video support available in cases where it's necessary. So far, we haven't really had the need to do that because the setup process itself is fairly simple, especially with referring to the videos.
Thanks. And how easy or difficult is it for people with glasses to use the microscope?
Well, with glasses, it's actually quite easy. I used to use glasses myself, and it was actually there's a benefit to using glasses, because with looking through the eyepieces, when wearing glasses, you actually automatically at the ideal distance from the eyepieces to be able to see clearly through the microscope. We find that often people who don't wear glasses end up trying to go too close to the eyepieces and then struggle to see because the eyelashes and everything gets in the way. So the ideal distance is actually, if you imagine yourself wearing some glasses, that's the best distance to be away from the eyepieces. And then obviously if you're wearing glasses, it would just make it easier.
So it's an advantage then, yes?
It is a bit of an advantage, yeah. So I had to learn again, just to remind myself not to go too close without glasses.
Is blood microscopy useful for supporting clients who have taken experimental injections? And if so, in what way?
Yes, that's a new, quite a new area that we're working in, and live blood analysis has been extremely valuable in these cases because, it's such a different type of test. We're looking at the blood; it's a visual analysis of live, living blood cells. There's no other test really available out there that does the same thing, and practitioners have noticed very interesting things in their clients. There's been practitioners with many years of experience who've worked with their particular patients where their samples were improving and things were going quite well. And the only thing that really changed is that they had the injection, and the practitioner started seeing really unusual things in their blood samples. So this is a very valuable tool in these cases. We're able to see what's really going on at the cellular level, and we can see various signs of excesses and things that are not supposed to be in the system. So some very interesting observations have been made. We are working on collating all the information still and putting together a list of common areas that seem to be, common anomalies that are featuring in these clients. We've also been able to monitor and reverse these indicators and these changes in the blood of clients. So we've developed a few protocols to help clients deal with the negative effects as well.
Thank you. Back to the microscope. How do you stop it getting dusty if you're transporting the microscope around?
Right. Well, the microscope, if it is assembled, there's not really much risk of dust getting into any of the important components. There is a dust cover, of course, just to keep dust off the stage, but that's usually easily wiped off with a dry cloth anyway. The lenses and objectives and condensers and so on, there's not really a risk of dust getting into those. Once it is assembled. Obviously, if it's disassembled, there is the risk of that happening. We find that there's some dust that collects on the field iris diaphragm at the bottom of the microscope where the light comes through. That's about the most common area where one would notice dust. It doesn't really cause any issues on the screen. If there's a thick layer of dust on the field iris diaphragm, for example, we don't actually see dust in the sample or on the screen. It just affects the brightness to some degree, and that's fairly easy to wipe off. In a day-to-day practice, it's more important to manage the oil. It becomes more of an issue. The immersion oil that we use for dark field can end up on the stage. Especially if one moves around a lot in the dark field sample, and that's something that has to be cleaned off. But that's not really difficult. It's just an alcohol swab to wipe away the oil.
Thank you. And how much does a microscope cost?
Well, prices vary from about $6,000 to $7,000. We have 4 different models that are available, and it's really just based on the 2 types of light sources and the 2 types of cameras that we have available. So it's just different combination of those. And there is also an entry-level microscope available for practitioners, for our course attendees. And that's a fully functional, proper dark field microscope with all the necessary specifications for dark field at the lowest possible price. It's a system that can be upgraded and added to as time goes, but from the initial setup, it has all the necessary requirements, and that's also an important point. There are many microscopes being sold online that are called dark field microscopes, but don't actually have the correct specifications for live blood analysis.
Thank you. Are there any blood microscopy indications relating to electromagnetic microwave exposure?
Yes, there are. There are a few anomalies or parameters that are related to EMF, and this has been researched to some degree. If you've looked on the internet, you might have seen some pictures of blood samples, especially products that aim to manage EMF. You may have seen pictures of blood cells that are stuck together before, and then images where the cells are all separated after. That does occur to some extent, but not really as noticeably in most cases. In most cases, in day-to-day practice, we're actually able to deal with what we see in the blood and reverse those patterns through normal naturopathic means without specifically having to address EMF. But there definitely is an element of susceptibility, and some clients are particularly susceptible to EMF. And in those cases, it really is important to work on those areas and to address EMF as a potential cause for those problems. So there are specific anomalies to look out for, and there's also a type of test where we look at how the blood breaks down over time. So how the actual blood cells break down while sitting on the slide. And we find that a high level of EMF does speed up that process as well.
Thank you. What is the standard charge for live blood analysis? Is any of the process ever covered by health insurance?
Right. Well, to my knowledge, there aren't really any health insurers that cover live blood analysis. It is a complementary medical type of procedure, and I'm not sure if any of the health insurance companies cover any complementary medical procedures, iridology and things like that as well. The charges do range depending on where you're based. Some practitioners charge from around $100 here in South Africa. I know in the States it does vary quite a bit as well based on where you're practicing. So it is usually recommended just to look at what other practitioners are charging in your area, especially for the amount of time. So whether they're doing live blood analysis or not. Generally, the first session takes about an hour for live blood analysis, about half an hour for the analysis, and then just enough time to explain and discuss the findings with your client. So we usually recommend just to look at what people are charging for an hour's consultation. But regardless of the price, patients usually feel after being for a live blood session that that it is far less than what they thought it would be, because of the information that it uncovers. A few 2 or 3 tests with a conventional laboratory is already quite expensive, and often doesn't tell you much at all. So there's so much value and so much valuable information from a live blood analysis session, that we're actually all charging less than what we should be.
Okay. Would you be able to see if there is too much of something in the blood through the microscope, for example, potassium?
There are some anomalies related to excesses, but we're not really able to see specific minerals and specific vitamins and their levels. The same with hormones. We're able to often see that there are signs of hormonal imbalance. but we're not able to see which specific hormone is the issue or what the level is. There are a few exceptions like adrenal hormones and cortisol and so on. With minerals, we can see, for example, there's an anomaly related to high levels of calcium, hypercalcemia, often connected to people taking inorganic calcium. So, people that are often advised to take calcium for their bones and end up taking just calcium carbonate often end up with this type of pattern. So there is for some minerals and some vitamins, there are specific indicators, and then there are also general indicators that show mineral imbalance and vitamin imbalances in general.
Thank you. Can I start your course with my old microscope before I get a new one, or is it better to get a new one and then start the course? And can I get the microscope in the UK?
Right. Well, yes, we do ship to attendees all over the world. So we've sent quite a few to the UK, to the US, various other countries, and we usually send the microscopes with the correct plugs as well to ensure that you are able to just simply plug the microscope into your wall socket to get going. If you have an existing microscope, it really depends on the specifications. So we could discuss the specifications required for live blood analysis. Not all microscopes are suitable, and not all dark field microscopes are suitable. So it depends on whether your old microscope has the required specifications. We do also allow practitioners to enroll in the course with a more basic type of microscope. So if it's not a full dark field system, you'll still be able to enroll in the course, but we do recommend upgrading to a high quality professional dark field microscope before seeing paying clients. The main reason being that there's a large number of anomalies that you'll potentially miss if you don't have a proper dark field system.
We have a webinar next, or a Zoom meeting next Tuesday, the 16th, which is Dr. Okker answering questions about microscopes specifically. So I'll put a link in the recording that I'll be sending you by email to invite you to that as well. So we'll be talking specifically about microscopes in that, won't we?
Yes, absolutely, and it is an important one. There are some practitioners we've had in the past who, they realize they're doing a course on dark field, and then in good faith go out and purchase a dark field microscope online. And if you look around, you'll see that there are dark field microscopes really at a fraction of the cost of the systems that we supply. Unfortunately, those microscopes don't have the required specifications, and practitioners who are new to microscopy obviously don't know what all the terminology means, and they're not really familiar with what to look for, and often make the mistake of buying a microscope that's not suitable for live blood microscopy. It is a challenge because if your microscope doesn't allow you to see everything that you've learned about in the course, you went through may have gone through the trouble to look for a course that will teach you everything that you should be able to know about in the blood. But if your microscope doesn't allow you to see everything, it really makes it very, very difficult. And practitioners who purchase these microscopes then have to try and resell these microscopes when they realize that they're not actually suitable for live blood analysis. So it is important to look out for that, and to be familiar with the specifications. The simplest would be really just to look at the light source to start with. If you can find out the strength of the light source, that will actually reduce the number of potential microscopes to a fraction, because the standard laboratory microscope with the 20-watt halogen or 3-watt LED light source doesn't have enough brightness to actually produce that high degree of contrast that we need in dark field microscopy.
We see a lot of attendees making that mistake, don't we?
Yeah, absolutely. It's unfortunate, and you can see it then with the pictures that they send in as well. You can just simply by looking at the dark field picture, you can see that it isn't really from a proper dark field microscope. And that's also what we recommend to attendees who are looking at purchasing a microscope for dark field live blood analysis, to actually if they, aren't able to go through all the specifications, to simply ask the supplier if they can send them an image of a live blood sample done in dark field with a microscope. If they have that available, you'll be able to see very, very quickly whether it's, showing you what you should be able to see.
Because the problem is that a lot of the suppliers of these dark field microscopes for live blood analysis don't actually know about live blood analysis. They're not aware of the specifications, so they're not deliberately misleading. It's just that it's just not general knowledge, is it?
Absolutely, absolutely. It's true, Elizabeth. It is quite niche, and the people that worked with dark field microscopy for live blood analysis worked out what combination of features are important. Michael Coyle from New Life Sciences had a very specific set of features required for microscopy, and if any of those specifications are compromised upon, you actually end up with an issue with what you're able to see in the sample. You lose some of the quality in the dark field image, and that limits what you're able to then see in your samples, which then at the end of the day affects your results.
Because then you miss out on a lot of the anomalies, right?
Yes, absolutely. So, there are some anomalies that are visible in bright field with a normal basic bright field type of setup, but most of the anomalies, and certainly most of the anomalies that often sort of drive the direction that one takes in terms of treatment with a client, are based on what we actually saw or see in dark field. So if you're not able to see everything that you should be able to see in dark field, you'll often misdiagnose or miss the case completely. And one can get results with a type of a shotgun type of approach, where you work on general imbalances that affect most people, and we do get some results in most cases, but you often end up hitting a wall quite quickly with chronic cases if you're not able to really work out what the main issues are that need to be worked with in that individual case.
Thank you. So going back to the question, would it be better for this person to start the training course with their old microscope and then learn what's really needed? Or is it better for them just to get a new one to start the course?
It is always best, if it's not a proper dark field microscope for live blood analysis, it is always best to get set up with a good microscope at the beginning of the course, so that once you start taking blood samples, you're at least able to look through them and see what you should be able to see. A more basic microscope will only really allow you to see anomalies in bright field. So bright field live blood, and then dry blood we do in bright field as well. But basically all the dark field anomalies will not be visible at all. So, to become familiar with those, you do need a good dark field microscope.
And that's where we see the pleomorphic forms, isn't it? Which is the most important aspect.
Yes, absolutely. Yeah. Those are really important, and they're quite faint, so very difficult to see. Most of them are not visible at all in bright field, or they only become faintly visible when they're really at a very advanced extreme stage. You really want to be able to identify those at a very early stage, and to manage them and work with them from early on in the case. And it's only really possible to do that with a good quality dark field system.
Okay, thank you. And in the course, are you teaching what supplements and therapeutic protocols are recommended?
Yes, absolutely. So that's also one of the benefits of our training course, is that we've included specific protocols and interventions under each anomaly. That really is very important. It doesn't really help to know exactly what's going on at a cellular level with a client and not really know how to address any of those issues. So we have a list of recommended interventions under each anomaly, and these include things like specific nutritional changes, dietary changes, supplementation, specific herbal combinations as well. And these are based on the literature available in live blood analysis, and also from our own practice and from our partners' practice as well.
Okay, thank you. Leslie's saying, I find the general live blood analysis very believable and interesting, but I struggle with understanding the oxidative stress test and how it could ever have come about or been discovered as a health indicator. Also, I think I would struggle with getting the 8 dabs of blood on the finger, as I'm not very dexterous. Would it still be useful to practice without using the oxidative stress test?
Okay, the oxidative stress test, also called dried blood analysis, is very valuable. I used to practice using just live blood analysis for some time before finding training on dry blood analysis. And you're able to deal with clients just purely looking at their live samples, but there's a lot of information, really a wealth of information that comes from dry blood analysis, things that are not normally visible in live blood samples. And in many cases, it just provides context, and it explains why certain things were seen in a live blood sample. It just makes it easier to work with your clients. It adds to the information that you have when working with clients. So it really is extremely valuable. And even if you're not able to get all 8 spots on the slide, even if you're only able to get 5 or 6 drops, it'll still be valuable and will provide information that will help you in dealing with your clients.
Thank you. Will the microscope work with the various standard voltages in different countries?
Yes, absolutely. So the microscope is compatible with a very wide voltage range. I think it's from 100 volt to 230. So it works with the voltage provided in the US as well as in other countries.
Thank you. Do you address the changes the blood makes when moving from the body to observing under the microscope?
Yes, that's quite an important point. If I understand the question correctly, the blood starts changing as soon as it leaves the body, and managing that is quite important as well. So that's something that we cover in the training, in the sampling procedures, to ensure that the blood doesn't really change drastically, because of the sampling procedure itself. It's very important to manage that so that the samples that you are taking are reliable and repeatable. And also then the changes taking place over time as the blood's allowed to sit on the slide, that process of breakdown in the sample, that's several hours over which that occurs, and that's something that also can be monitored and can provide very valuable information to the practitioner, and that's also obviously included as part of the training course.
Are any textbooks recommended to purchase to accompany the course? Currently, I have 2 books, Intro to Darkfield Diagnostics by Schertl and Arnoul, and Advanced Dried Blood Cell Analysis by Donna Gorafabo.
Right. I do have those books as well. I'm familiar with them. They're useful because they also have nice color images, and it's a useful resource to look at examples of blood samples. There's some interpretations there as well. But like with many other courses out there and other literature out there, it only really provides one point of view. So those are more books based on pleomorphism. So the interpretations really are mainly around pleomorphic changes. In our training course, we've combined all the schools of thought really into one comprehensive course. So when we're looking at a particular anomaly, we have an understanding of how it's developed according to pleomorphism, and also the other factors in diet and lifestyle that may have influenced the anomaly, various medical considerations as well. So this just provides, the more information, the better, and it provides the practitioner with a more complete understanding of what they're looking at when they're looking at a blood sample. So we do have some book recommendations, but they're really only recommendations. The information that you really need to be able to assess blood samples is provided in the manuals.
Okay, thanks. Please clarify dried blood, bright field and dark field, and live blood.
Oh, that's a great question. So with live blood analysis, we actually take two samples. There's a sample that's taken and placed on a slide with a cover slip over it, where we look at the cells under high magnification. That's a live blood sample, and that's usually done first in bright field and then in dark field. And then there's a second sample that's prepared on a separate slide where a drop of blood is pressed onto 8 consecutive layers on the slide. That's allowed to dry, and then that's viewed after the live blood sample in bright field at low magnification, where we're looking at the patterns that form when the blood dries on the slide. We use mainly bright field and then dark field. Dark field is especially important for looking at live blood anomalies. And if you've not come across the terminology before, bright field is basically what most of your standard laboratory microscopes would use, where the light basically is transmitted through the sample from the bottom up into the objectives. In dark field, the light is scattered, and there isn't really light going vertically up into the sample, but it's scattered, and then we actually get to the sample being illuminated from the sides. And in dark field, we have a very dark background with all the blood cells then being quite bright, and we're able to see all the small fine elements, all the small structures between the cells, fibers and things like that in the sample that are not visible in bright field, just simply because of the illumination technique.
The dark field allows us to look at the plasma, doesn't it?
Yes, absolutely. So, when we switch over from bright field to dark field, clients are often amazed as well at how much the sample comes alive. There are things in the plasma moving around that were not visible at all in bright field. So it really does open up the world, in terms of what you can see in live blood sample. And without dark field, it really becomes difficult to properly assess a live blood sample.
Thank you. I have a colleague who has a telescopic lens. Is this something you supply as an option? And would it bring any benefits in conjunction with your microscope?
So telescopic lens is something that was more commonly available in the past. It's a type of lens that fits between the microscope and the camera and allows the user to basically zoom out from the sample. The main benefit there is really to be able to reduce the magnification. And with live blood analysis, we obviously want the highest level of magnification available. But with dry blood analysis, when we're looking at those 8 individual layers of dry blood, we actually want less magnification to be able to fit the entire sample onto the screen. In most cases, it's not really possible to do that because of the magnification with these microscopes, but with a telescopic lens, one's able to zoom out somewhat to fit more of the sample on the screen. We don't supply them. They're quite difficult to get hold of, to source. We have tried a few and experimented with a few and tested some. The quality of the lenses were not really compatible for dark field microscopy. Anything in the path of the light affects the image in dark field. So the quality of the lenses are really, really important. We haven't been able to find something that is reliable. The other issue with the telescopic lenses is also the length of the actual tube. So one ends up with a very long distance then between the camera and the microscope. So any slight bump on the desk or any, just touching the microscope causes the image to shake. So that sort of instability is a bit of a downside as well. We don't also use them because most of the analysis for dry blood analysis is actually done through the eyepieces of the microscope. So the analyst looks through the eyepieces of the microscope initially to look through those 8 samples, and during that time period, one would identify all the anomalies, and only then use the screen to show the client what's going on in their dry blood. So only really some areas of the dry blood will be shown to clients.
Thank you. Would you record the results for comparison over time as an aid to show the client in live blood analysis?
Yes, absolutely. That's extremely important. So the microscope has a camera that's attached that allows you to see the live view of the blood on your screen, and the software that's included with the camera allows you to take pictures, so still images, and you're also able to record video clips if there's something moving around in the sample that you want to record. That's also an option. Very important to be able to do this because clients do want to see how things have changed after the interventions and after following your recommendations. So it is always recommended at the beginning of a follow-up session to bring up the client's pictures of their previous test and to then show them a comparison between the two. In practice, we often find that it isn't always necessary because often people come back and they remember what their blood looked like the last time, and they've been worrying about it and following the interventions and hoping to see that it has improved, and they often point out the anomaly on the wall chart. That's what it looked like the last time, and they're quite keen to see how it's changed. So that motivating effect is extremely valuable with live blood analysis, and it really helps to get people to come back for the follow-ups to see how things have changed, even if they're not feeling a tremendous amount of improvement, which is often the case in chronic cases. We don't really see changes in symptoms after a month of treatment. Sometimes things even get worse, but in looking at the live blood, we can show clients that things have shifted in the background and that there have been substantial improvements, which really is very encouraging for people to see.
It's very motivating, isn't it?
Absolutely, yes, absolutely. So people are motivated to keep up, and we often find it with clients. People change their lifestyles completely. It's not just a case of going onto a diet for a period of time to achieve some sort of goal, because of the education that comes with live blood analysis. They start to understand how what they're eating impacts on their health, and they simply don't want to do those things anymore. So clients that came in and said, they'll never give up chips, for example, or crisps, once they see how your blood's affected by that, it's actually very easy for them to say no, thank you.
What type of testing or clinical is provided to certifiers as blood microscopists at the end of the course?
All right, so the training materials, we have an online training platform, and on the online training platform, after each module of the training course, there is a test element that needs to be completed. So those need to be passed. And then at the end of the training course, there's an assignment that needs to be submitted on the training site for certification. And the assignment, if I can just elaborate on that, the assignment is basically a case study showing an actual case of a client with examples of what was seen in the blood, interpretations, and the interventions that were chosen as well.
And the last 3 lessons of the training course are dedicated to showing you how to put together your own case study as well, isn't it?
Yes, absolutely. So in the last few weeks, we go through actual case studies. Very valuable to see that, because we actually see how all these separate anomalies can then occur, in actual live clients, and how we see these separate things coming together to basically create to tell us what's really going on in the client's state of health.
Okay, this seems to be the final question. Are there online social media support groups of live blood analysis practitioners around the world?
Yes, there are. We have a practitioner forum, a private Facebook page where present and past attendees can go on, chat to each other, post their findings, ask questions, and a very, very good platform for ongoing learning as well.
It's a great place for sharing information, isn't it?
Absolutely, yeah, absolutely. And any questions that come up, it's good to have a base of practitioners that you can quickly ask as well. So it's a very good resource.
Okay, so that brings us to the end of all of your questions. Thank you very much for joining us, and we hope that that's been useful to you. We'll be sending you a recording of this Zoom meeting, and also with links to information about the training course, and also an invitation to next week's Zoom meeting about microscopes, and all your questions answered about microscopes. Just also mention, we do have a 2-part payment plan, which if you'd like information, please drop us an email. Again, I'll put that link in the email that we're sending out to you. So again, thank you very much for joining us, and we hope you join us on one of our training courses. So thank you very much, Dr. Okker. Anything to add to that?
Thank you very much, Elizabeth. Yeah, the only thing really is that live blood analysis, from everything that I've done in my practice, has been the best thing that I have added to my practice. It really made a huge difference to how I was able to work with clients and assess what really needs to be done with them. It really isn't anything that ticks all the same boxes as live blood analysis, in being able to provide the practitioner the information that they need to work with their clients and to monitor their clients during the course of treatment, and also to have the necessary impact, on clients to get them motivated to start doing what they need to do to achieve, optimal health.
That's what it's all about. So yeah, thank you very much. And thank you all very much for joining us. Look forward to speaking to you again. Thank you, and bye-bye.
Thank you. Bye-bye.
Bye-bye.